Is there like at all an amount of alcohol that's like a safe amount of alcohol? Everyone wants to know this.
It's funny you asked that. So a few months ago, the recent US Surgeon General had brought up the idea of putting warning labels, an extra step to help caution people from drinking alcohol in all alcoholic bottles, talking about the potential carcinogenic risk. And so we know that at least seven types of cancers are associated with drinking alcohol. And so the big question is, well, what are the guidelines right now? Right now, the guidelines currently state that for men, up to 2 drinks of alcoholic beverages per day, and for women, up to 1. Although some studies do talk about that even less than 1 drink per day can actually associate with cancer risk, with increasing your risk. And so when it comes to, for example, red wine, people talk a lot about that. Well, in the past, we've talked about maybe it's good for you. Maybe it's good for your heart. Maybe it can lower cancer risk. In fact, there are studies that show that people in the US do still think that alcohol could be actually lowering cancer risk. But that's another point. In regards to red wine, I like to take it back into what about red wine could actually have some benefit. Resveratrol, it's a big word we use on social media, it's a compound within red wine that has associated anti-inflammatory effects that could potentially lower some risk of chronic diseases. Well, you think about what else has resveratrol. Grapes and berries. Fruits have resveratrol. And so instead of thinking about, well, maybe I should drink a glass of red wine to be healthy, why not just eat some fruits? And that's what I'd like to refocus the idea.
Well, I've also seen those studies that show that you'd have to consume so much alcohol to get the benefit of the resveratrol, where it's actually anti-aging or good for your health. But then by that point, it's just scratching the health benefit because you're drinking so much alcohol.
Exactly.